Hello, we're back. We're back. Are we the right way up this time? Let us know.
I think we are.
Where we are in your on your screen, and hopefully you can see us the right way up, because that's really awful looking at us sideways. So, as I say, we're the infant feeding team. It's Thursday, so we are doing about an hour session on anything to do with infant feeding. So you might be pregnant, you might be breastfeeding, you might be formula feeding with bottles, you might be giving breast milk in bottles. It doesn't really matter. We are here to support you and answer any questions that you might have. If you have questions about scans or induction or visiting, direct those to your Ask the Midwife sessions, because they are more up to date than we are on the changes that are happening all the time. So, and any questions is just wonderful. So let us know if you can hear us, and we'll start answering your questions as they come in. We'll wait. I hope you're all well this week. So the news, as you all know, is that the COVID vaccination has started. So we just thought we might talk a little bit about that, because I'm sure you're all thinking about what's going to be happening to you and your families. And at the moment, we don't know is the answer. They're still arguing out what will happen with pregnant mothers and babies with vaccination programme, and at the moment they haven't got enough information, I don't think, to make a decision. So we don't know what the recommendations are going to be, but they're working very hard on it and discussing everything about it, so that they can roll that out and give you that information when it's available. So at the moment we can't tell you any more.
A very good website to have a look at is the Breastfeeding Network. The Dr. Wendy Jones, who is a pharmacist who's a specialist in lactation, does lots of information on that website, and she looks at drugs in breast milk, and she's actually been posting about the vaccine, saying obviously at the moment we haven't got enough information to know whether it's appropriate for breastfeeding mothers and pregnant women to be having it. So it's well worth a watch. Keep an eye on her website, because she's most likely to be the one who'll have the most up-to-date information. She's
working flat out, isn't she? And she's rewritten a lot several times already, and had to, the information's changing every day. So keep an eye out for that, because I'm sure it will be announced very quickly once it's available.
Yes, that's the Breastfeeding Network. But, so hopefully, more information will be forthcoming. But obviously, most women are going to be falling into the groups that'll be probably lower down the line anyway, just because of their age groups, because it's going to be the elderly and the vulnerable first, so it's going to be a while. So it will give a bit of time before we get to that age group to know what's going to be happening and whether it's appropriate to have the vaccine or not. But always remember that breastfeeding your babies is really, really important, and this shouldn't be something that should be swaying you to stop feeding, because actually by breastfeeding your baby, you are protecting your baby. I mean, you are setting your baby up for lifelong health. In a way that no other milk can do, not even donated. Donated is wonderful, but it's still not your milk. Your milk is totally, utterly bespoke for your baby, and nobody else can rival it. So, it's going to be a tough one for some people out there. But do please, don't think lightly of it. It's very important that you're giving your baby your milk.
And we know that in Holland, I don't think we said this on the sessions before, but in Holland, mums are they're using baby breast milk to treat patients with that have had COVID, and the antibodies in the breast milk is not destroyed by pasteurisation, so they have got lots of antibodies of COVID positive mothers that are breastfeeding, and they're giving it to patients that are sick, and that's really supporting them and helping their recovery, because they're getting antibodies through the breast milk, and that's in Holland. So it's amazing, really.
And knowing breast milk, it's going to be way more than the COVID antibodies as well that's going to be beneficial. So I'm amazed. No questions, ladies and gentlemen.
No thumbs up, no hellos. Is everybody able to see us? We can see us online, so hopefully some of you are watching. Give us a yes or no if you can't see us or hear us or something.
And if you've got a question stored up, go for it. Last week we had an amazing array of questions, fantastic array of questions. So we begin to wonder if we're just talking to ourselves. If you don't, so give us a thumbs up or something. So
absolutely,
you can hear us. Do say something. Do
let us know, because it's unusual not to have hellos at this time. Yeah. To see, we've normally talked and got lots of questions backed up, but hopefully we've got people watching. The other thing that we would talk about, it's something that we are starting to do on the postnatal wards and in the antenatal sessions. we're talking about postnatal early days. So this is beneficial to people that have obviously had their babies, but also people that are pregnant as well. So it's just talking about the benefits, not the benefits, shouldn't say the benefits, the advantages of giving breast milk and having skin to skin with your baby. So it's just about how important and how vital that role is for you, and how it impacts you and your baby's health just by having lots of cuddles and things. So we're talking about relationship building, skin to skin, breastfeeding, talking a little bit about hand expressing, why we'd do that, and how you would know your baby's getting enough, and also where you can get help. So we just thought we'd put that session out here today as well, just to see if you find it helpful. So do you want to talk about that one? It's going to be there, aren't you?
So we're talking about relationship building, and this is the poster that we're using. We've got some lovely big ones that we're using on the wards, and we're going around and talking to the mums. And we're talking about the fact that, if you see this as a brain, we're talking about the fact that that relationship that you build with your baby, that closeness and loving relationship that you have with them, is building a baby's brain, because your baby's brain is bathed in oxytocin every time you love them, cuddle them, look at them, talk to them, sing to them. All these things are going to help your baby's brain grow really well. It's oxytocin is the fertilizer for the brain. So we talk about how you transition from being a mother with a baby in utero, in your tummy, to the mother with the baby in your arms. So when your baby's in your tummy, your baby's getting used to hearing your voice, and that's so soothing and calming for the baby. It's really important. They get used to your rhythms, they get used to your day, and they get used to the noises of you, including your heart. And so when that baby's born and your baby has arrived, cuddling and loving your baby, keeping them close where they can feel your heart rates up against you, talking to them, singing to them, all these things are really fabulous for growing your baby's brain, calming them and soothing them. Because babies, when they're born, they don't have the capacity to self-soothe, they don't have the ability to do that. So it is your role to do that. It is your responsibility to calm them. I'm going to lift that down because it's back to front, so you can't read it. It's the parent's responsibility to soothe and calm the baby, and to help that baby regulate their emotions. So it's really important that you keep the babies close. We talk about slings all the time because they're really, really useful. They meet the baby's needs for closeness and comfort, but they free many parents find they free their hands up and allow them to get on and do other things. It might be that you want to make a sandwich, or you want to pop something in the washing machine, and you don't want to have a baby constantly that you have to hold. So a sling is a fantastic way of getting around that, but meeting the baby's needs. So as I said, they can't self-soothe. You're there to do that. A breastfed baby can't be overfed, so you can't give a breastfed baby too much food. Breastfeeding is always the answer. If a baby's unsettled and happy, the baby's looking for comfort, then a feed is always the answer with a breastfed baby. And they cannot be spoiled, regardless of how you feed them. You cannot spoil a baby.
I think that's the most important thing, isn't it? To understand, when you get pressure from other family members where they're just saying, you're holding that baby again, you're making a rock your own back.
Yeah, is that baby hungry again? How can that baby be hungry again? You've just fed it.
Yeah, so. And that you can't do that. That's what all your baby knows, and you are your baby's world. And that's what they want to have. They want to be close to you. They've been inside you for 9 months, and that's where they want to continue to be. And I always say, think about monkeys. They don't let their babies down. They cling to their mums, and they've got their little babies have got their hands like this. Well, that's because we used to be furry, and they're there clinging onto their mummy's fur. And that's what monkeys still do, but we used to do that millions of years ago, and babies still do that because they're made to be clinging to you and made to be hanging onto your body and being carried. So they're not meant to be put in a cot or in another room away from you in the early days, and we know that.
And through all of this, you're growing your baby's brain, because you're bathing your baby's brain in oxytocin. And oxytocin, as we've said, is the love hormone. It's the hormone of attachment and bonding, and it's the fertilizer for a baby's brain. So the more that we can do that, the more you're going to end up with a baby that is confident, independent, and will trust that you're going to meet their needs and be prepared to take that step away from you, because they know you'll be there when they want you. So it's very important.
I've got one question. I've been looking at my phone while Alex is talking, and I have got one question from Lindsay.
We've got no questions on our laptop.
Yeah, no, it's funny, isn't it? We're not getting anything at all through. So maybe no one's watching today, they're busy buying Christmas presents, but so this is from Lindsay. She says, "Hi ladies, thanks for running these sessions, so helpful. Baby is now day 16 and breastfeeding has been going really well. However, in the last few days he started jerking and tugging on the nipple at certain feeds, especially morning and evening, and it gets quite sore. Any idea what's causing it or how to stop it? Thanks."
Well, thanks for sending a question through, and I'm redoing it to see if I can see it, see what's happened.
Yeah, you've got a few questions through.
Oh, they're there. You see, that's meant to come up when they go up there.
Yeah.
There they are.
Yeah.
Thank you. I was thinking, wow. So
Lindsay, 16 days. So there's sort of a little bit of a magic number at about 2 weeks with breastfeeding, and the supply often changes a little bit at about 2 weeks, where your body's put the order in, and that's where we talk about the little window where you can get your milk production going. And it was going well at the beginning, and what may have happened is you may have either got lots of milk and it's all a bit much for your baby. If you've got lots of milk, are you very full when he's pulling off, or does your breast feel less full at the time that he's pulling off? And are you giving any bottles? Those are the questions that we sort of ask. So if you can sort of fill in the gaps a little bit, that might answer more clearly what it could be. But it could be that the flow is very big for him, or it might be that the flow is not enough for him at those times. So if he's getting a bit too much too quickly, it might be that he needs to get his attachment slightly deeper. It's great that he's done so well so far, it's absolutely fantastic. But it may be that he needs to go on slightly deeper, and then the flow, he will get what he wants from the breast, and he'll make the next feed. If he's on the end a little bit, quite often they don't quite get what they want and they get cross. And if it's not enough, it's the same, they're not getting the flow if the supply is a little bit low. And you can do your compressions and see if that makes a difference. So holding your breast as far back from the chest wall as you can go, and squeezing when your baby's suckling, and letting go when they stop suckling. So if he's pulling, then start doing some compressions to give him a little bit more, but make sure that he's on the breast properly, really deeply. See about positioning and attachment to see if he could go on a little bit further. Is his mouth wide enough and things like that? Is he getting a big enough mouthful? It could be either of those things. It might be that the flow is high, or it could be that the flow isn't enough. Both cause those things. So give us a bit more information, or if you don't want to do that, ring us and we can talk to you on the phone.
Yeah.
Or you can ring Oxfordshire Breastfeeding Support, or the baby cafes, or La Leche. They will all be able to talk you through what's going on. Yeah. But do contact someone, or give us a bit more information, and we can talk over this session if that's what you'd like to do.
Amy came and said she could see us. Thank you, Amy. Thank
Brilliant.
you very much. Pasqualina said, "Hello, any advice for increasing my milk supply? My daughter was born last Thursday and was in the NICU for a few hours of her life. Owing to, I've got a frog in my throat. Owing to low blood sugar levels. I was hand expressing colostrum for her. I'm going to have a drink. Bear with me. I can't
read from here. We're both at it today, aren't we? Hopeless. I can't see it from here, Alex.
We've had such a busy morning. She was hand expressing for her, but the doctor said she needed a top up. Whilst in hospital, she was topped up with donated breast milk, and since being home formula, we're getting there with the latch and I'm pumping, but I can only get 20 to 25 mils max per breast. Per breast, that's 50. My intention is to reduce the formula so she will be eventually able to exclusively breastfeed. That's a fantastic thing to aim for, Pasqualina.
So you're worried that she's not getting enough? You think that you haven't quite got enough, and she's about a week old? Is that that's what you're saying, isn't it? I kind of got a bit distracted. I think the most important thing at this point, she's presumably going to the breast and suckling, is she? But not happy, or?
Let me have a look. Sorry about that. I just needed another drink.
So if she's not going to the breast, you need to protect your supply fully by pumping at least 8 times a day.
She was only born a week ago. She's a week.
And you're getting 50 mils out. I mean,
you're doing really well.
Massive amounts of milk.
Really well.
Of milk. And the problem is that you've seen her have a bottle in the neonatal unit, haven't you, with top-ups, and that makes you quite nervous about volumes, because they give huge volumes in the neonatal unit to support your baby's growth and development, to make sure that they get enough fluids. And so they get used to much bigger volumes than a baby at the breast on day, say 1 or 2 would be getting. So it sort of distorts what you should be getting as a normal, but actually 50 mils at 7 days is pretty impressive if that's what you're getting per pump session. Are you doing 8 pumps in 24 hours? Because that's about what your baby would feed, so 8 to 12 times in 24 hours. If your baby's attaching to the breast and suckling that many times well, and the attachment is good, then your supply should continue. And obviously you've got milk as well that you're giving her in a bottle. Is that the understanding, that you're topping her up as well? So I think what you could be doing is what I said a minute ago with the compressions, is when she's feeding, do some compressions. So you're squeezing your breast, you're not pumping, you're holding and squeezing. And then when your baby stops suckling, you release. And then when your baby starts suckling again, you hold and squeeze, and that's pushing milk into your baby's mouth, so that's giving more milk. It's like pumping while you're breastfeeding.
Yeah, it's brilliant.
And it really fills your baby up with milk from deep within your breast. So try doing that. The other thing you can do is a little bit of switch feeding if your baby's sleepy at the breast because of the flow. So if your baby falls asleep after a few minutes, take her off, put her on the other side, or him, and then go back to the other side, and then go back to the other side with some compressions until they start to wake up and feed a bit more. And that protects the milk supply, it increases your milk supply. The switching and the compression builds up your supply naturally. And then you're pumping on top of that, so the chances are you're going to make a lot of milk if you keep doing all of those things, and your baby will then start to glug at the breast more as they wake up and realise they're born, and that sometimes takes a few days. And then you'll realise that you can't top him up because he's had too much. He's had enough and he doesn't want any more. And then it might be that you top up once or twice a day, and then you're nervous about that, but then you can drop them. I think you need to talk to your midwives when they come to visit you and just get them to watch a feed to see how it's going. And you haven't said if you're sore or not. So
no, it's a little girl though.
Okay, so just see how you go, and if you've got more questions, do contact us, contact OBS, talk to your midwives. That's the most obvious thing because they're still visiting you, or you're visiting them, to get some more support. And if they feel there's a problem, they will advise you to call us as well if they think that would help you.
So good luck with that, Squilina. I'm sorry about my coughing fit in the middle. We haven't got any other questions. It's very quiet today. I think Naomi's right. I think everyone's out Christmas shopping.
So the next thing we can talk about then with what we're talking about is the importance of skin to skin, and why do we do skin to skin for babies, and what is skin to skin, because actually people do ask us that after they've had their babies. They don't really quite know what we do mean by skin to skin, but skin to skin in the first hour is really important because that's the one that primes your milk production. It's the one that primes your baby to know where to go to breastfeed. And it's the one to regulate your baby's temperature, breathing, and calms the baby down. It's full of pain relief for you and for your baby. It releases oxytocin, which is a hormone of love, and it just gets your baby switched on to everything that's going to happen. So they know where to go when they're skin to skin after birth. They smell. They're directed by smell in the early days, in the early hours, and when they're born, their hands are covered in amniotic fluid, so when they've got their hands curled up and they're crawling, or they're left uninterrupted on the mum's tummy, they smell amniotic fluid in their hands, and the areola of your nipple, the little round bit around the nipple, is also, it secretes a fluid which smells the same as the amniotic fluid. So they smell the amniotic fluid and they know they've got to go towards that. They can see the change in the colour of the nipple and things, which is the pigmentation and things, but they go by smell, and so they move towards that and they move up, but they do have a process of things that they do, and the first one is that they cry, and then they come out and they have a little bit of a movement, and they settle their breathing, and they pause for a moment, and then they start to crawl, and then they might pause, and then they lick and explore, and then they might pause again. And they do a series of things till they get to the breast, and then they will suckle at the breast, and then they'll fall asleep. And they do this, every baby in the world does this, every baby in the world does this. No matter where they are and how they're born, that's the behaviour that they expect. Every mum will expect to play out these responses. And so what you mustn't do is disturb them when they're doing it, because it takes them about 56 minutes to do that process. And so every time you stop them doing it, they have to go back to the beginning and start again. So it's really important that they have that undisturbed time with that first hour in order to play out some of these responses and have a really good feed. And we know that that skin to skin secures the milk production, and secures your baby's bacterial transference, so they get bacteria from parents, they get, they're just set up for life outside the womb. So if you don't get it for any reason, then do it as soon as you can. If your baby's separated or you're poorly, then you do it as soon as you can, and for as long as you can.
So they're not all out Christmas shopping. There's something definitely wrong with the way it's loading, because I've got 10 pommets now.
Ah,
so
okay.
there you go.
So we're not putting anything on our screen at all today.
I have now, and it's not coming up there. So definitely, I think someone's done an update on our systems, and it's not working the same way. So we have got a whole nice load of questions. So I'll have to keep remembering to refresh so that I can see them. So
just remember, it's where your baby expects to be after it's born, and that continues for a long time. Any time your baby is upset, do skin to skin. So skin to skin is taking your baby's clothes off and taking your clothes off, or putting your baby inside your clothes without a bra on. So if you're giving birth, don't wear a bra.
Yeah,
take it off before you deliver, so that you can go straight to direct skin to skin, and that will allow your baby to crawl and have an uninterrupted skin to skin with you, and then continue to do it. Always go back to that skin to skin. Keep your baby warm underneath your clothes, or put a blanket around both of you. And when you're not sure what to do, your baby's unhappy, do skin to skin. That's where your baby expects to be. That's what babies should be doing at that stage. A baby in a cot across the room will not show signs of wanting to feed in the same way as a baby that is skin to skin with its mum. So if your baby is having a long sleep and you're saying it's not feeding, it's not going to do that if you're leaving it across the room away from you. And the cue that you will get is your baby will cry and be very upset, because that's the last cue, and you've probably not seen the other cues in the same way. So it's about keeping them close, letting them play out their cues, letting them seek the breast, and priming them for what they should be doing, which is frequent feeding as the time goes on. But skin to skin starts that, so it's really important that you get the opportunity to do that as soon as you've had your baby, irrespective, even if you've had a cesarean. And we do know that if you have had a cesarean, you get less chance to do skin to skin for lots of reasons, and we have discussed this a lot on these sessions. But do as much as you can when you can in theatre, and when you go round to the recovery area, then keep doing it if you can. But get a little bit in. It's not about your partner doing it, it's about you doing it, because that's the thing that primes your milk production. It's the real boost of hormones with your baby on you that creates you to produce milk. And we know that babies lose more weight if they've had cesareans, because they don't get the same extended skin to skin. So make it as much as you can when you can, and that will really contribute to your milk production.
Right, let's go to a question then. So Emma has said, hi, I have a little boy who's 13 weeks old. He's been exclusively breastfed since birth. He had 100% tongue tie from birth, so in the first 3 weeks I was expressing on top of him feeding from the breast. We had his tongue tie cut and was told I no longer needed to express, so I stopped. My baby likes to be fed often and for long periods. I'm finding it really hard, so we're trying to give him a couple of bottles a day to help me. He has forgotten to feed from a bottle. We tried express milk and more recently formula. He will not take a bottle. We have tried me being out of the room and hubby feeding him, different teats, making sure he's in a chilled mood and trying to be persistent with it once a day. He's gone from reacting with crying and screaming at the bottle to now letting the teat be in his mouth. Well, that's progress. And will roll his tongue around it but refuses to suck. Any suggestions? We've been trying for about a month. It's getting me down a bit as I'm exhausted with all the feeding. I can't do much else other than feed. Any suggestions would be great. So you've had a tough time. And do you know, we often hear this when babies are fed from a bottle initially, then they've gone to the breast and it's all gone well, and then actually when you needed to get them back on a bottle, it hasn't happened. So you're not on your own. We hear this an awful lot. Takes you by
surprise as well, because you were so good at giving the bottles in the beginning.
Yeah.
So
babies know that they like to be breastfed, so he's got to learn that it's nice to be bottle fed too. But thinking about, you said you've tried breast and formula, what's in it is irrelevant. It's actually to do with the fact that it's a bottle and it's a different shape and a different feel for him, and he loves being breastfed, obviously. But things to do, you've already tried having you out of the room and your hubby doing, but it would be trying at times when he's not hungry. So offering that bottle when he's not hungry. So, you know, after a feed, sort of midway between feeds, not doing it because you've said he cried and you've made progress now that he's not crying. What you do not want is a baby that's screaming and shouting, because if that starts to happen, you're going to end up with a real problem. He really will be refusing, and you already had some of that. So maybe just the minute he starts getting upset, stop, do something else and try again a bit later. But it's thinking about trying to make it a bit fun, making sure he's not hungry, because if there's an expectation of food, he's going to be going, but this doesn't work for me, this isn't how I have it. So he's going to be expecting the breast. So try and take it away from food and get him to learn, oh, actually milk does come out of here, and keep trying. I think that you've tried all different teats as well from what you said. Any other suggestions, Naomi?
This is really hard. Is it warmed so that it's the same temperature as breast milk? I mean, that's, you know, something else. I think sometimes it's just that they're not expecting to taste breast milk in a bottle, and that, you know, it's not coming out in the same way. You've said you've tried lots of teats. Have you done it when he's sort of in a dream sleep, so that he's just waking up and he's not conscious of it?
Very good time.
So, you know, he might not be really hungry, but do a feed and he starts to stir. The minute he starts to stir, see if you can pop the bottle in when he's still sort of sleepy, and they've got a good suck reflex and a good gag reflex, so if he's still sleepy, he will be able to suckle and take it, and then realise that it's not an awful thing, and that might happen.
Yeah.
I think always give him a present, you know, give him a breastfeed if he's really upset, so that he gets a reward.
Remember, he hasn't got the capacity to learn, so he's not going to learn, or if I kick and scream, I'll get the breast, because he's too young for that. He can't work, he's not habit forming yet. So he's just telling you it doesn't work for him at the moment, and he doesn't see it as a nice thing. So it's just reinforcing that it's a nice thing. And yes, give him a reward, like Naomi says. It's not giving in to give him the breast. That's not you not managing to do it, but that's meeting his needs at this point in time.
And actually, 13 weeks is quite a busy time for a baby. They have a really big growth spurt, and they do wake up at night more at that sort of age, 12, 13 weeks. They wake up and feed all night for about a week, and they are much more alert and awake, sort of moving on to the next stage. So the feeding that you've done in the first couple of weeks of their life is priming and calibrating the milk supply that they're getting at 3 months, at 12 weeks, or through 12 plus weeks. And so, you know, everything's been set up for this busy time that you're having, and so you might have tried to introduce it, although you said about a month ago you started, but it is coming up to a time when they're really quite sucky, and they do quite like breastfeeding a lot at this stage. So you might just leave it for a little bit and then go back to it and just see what happens, so that he sort of has a week or so of positive stuff going on, and then go back to it and try it again, perhaps when he is in a bit of a dreamy time and he's forgotten about it all.
Dream feeds are very good, but carrying on and persisting just becomes a bit of a negative cycle. So perhaps have a little holiday.
Feed aversion completely, which means that he might not go to the breast as well, and that would be awful for you.
Yeah.
So, you know, you don't want to get into that situation, so make it a positive all the time and give him a breastfeed if he starts to get really upset, so that he gets a reward.
I do get that you're tired and you would like him to have it. So
it's a hard time, 13 weeks actually. It does take it out of you, because they do start to want to feed more and be with you more, and can be quite, wanting to be cuddled and all of those things. They're just sort of waking up to what's going on around them a bit more.
Right, I'm going to move on to Erica, because we have got a few questions. I need to refresh again and see if we've got any more. So Erica said, I've got a 1-month-old son who wants to feed constantly when he's away, but only for 5 or 10 minutes at a time. He then stops and wants to feed again after a few minutes. He also uses me as a dummy. I was wondering what alternatives there were instead of giving him a dummy. The only thing that comforts him is the breast, but he does pull and fuss sometimes, and it's exhausting. Is he meeting his milestones, I would ask? Is he pooing and weeing appropriate to age and gaining weight? Now, I know gaining weight's a difficult one, because it's, clinics where scales would be are few and far between. I'm just wondering if he's perhaps needing a little bit more food here, Erica, if that's why he's looking for food quite so frequently. So is he still, are you still getting 6 heavy wet nappies every day? Are you getting at least 2 yellow stools a day? And if you've had him weighed recently, is he growing and meeting his, following the centile on the chart? I think it's a case of looking at those things too, and just making the breastfeeds when they do happen really work well for you.
And you revisit your positioning and attachment.
Yeah, that would be worth
to watch
it.
your breastfeeding. Maybe try Oxford Breastfeeding Support, see if they can support your positioning and attachment. See if your health visitor can do a session with you, just to see if the attachment is deep enough, because sometimes they can just be on the end and you've been breastfeeding for a month, so that you've got used to them on the end, on your nipple as they are, and not noticing that it's not so comfortable. You've got used to that, so it might be that he could go on a little bit deeper, and that might improve the fact that he's getting what he wants from the breast. Actually, that would lead on very nice to our positioning, because so this is the positioning chart. Does he look like that when he's lining up? So he's right underneath the breast. You can see his nose again opposite the nipple, and his chin is much further down opposite the breast tissue, and his head is not being held, so that you know, you're supporting it. It's a bit like going to the hairdressers. The hairdressers sink. Your head is just where that sink is. Your hand is where the sink is, so that you can bend your head back when you're having your hair washed. It's the same when you're holding your baby. It's supporting the base of the neck so that they've got complete movement. And then when they open their mouth, they're lined up in the right place.
That's the gape. So that the gape is a big wide open mouth, head back and tongue down. And you can see where the nipple is. The nipple's right up here.
So it's going right, it's just skimming over the baby's gum ridge, and it's going right to the top of the roof of the mouth. So you can see it's just literally skimming
right
the
up
gum.
here.
And then that goes over the palate and all the way to the back of the throat. And the chin hits the breast first, and the tongue scoops the breast into its mouth. And so they'd get a really, really big mouthful of breast, with their cheeks are full, and their nose is free, the chin is close, and they're engaged, so that you can see that they are really close and indenting the chin and the breast with their chin.
Nose free, chin in,
and
full and round cheeks.
Big mouthful, and they're engaged, they're transferring milk, and that makes a really big difference with the way a baby feeds. And the fact that they can actually milk the breast correctly, and they can also make the next feed, and then they come off very happily and look like that. And the nipple should be the same shape as it was when it went in the mouth, a little bit longer, but not elliptical or slightly squashed or have a line on it or be blanched. It shouldn't look like that.
No new lipsticks.
No. So have a revisit with them, just see how it looks when he comes off, and is there any squished nipple, and if it's not quite right, then just revisit that positioning and attachment and see if you can get a slightly deeper latch, and that might be what it is, that he's now suddenly thinking, actually I'm not getting quite what I want.
I think that would be a good idea, to get in contact with something like Oxford Breastfeeding Support, Erica, and just get some support. Really. Emma's come back there saying sorry for an essay for her question. That was absolutely fine, not a problem. Gillian said, hi ladies, very random question. It must be further down, yes. Her baby's 5 weeks old. I found out when I leave the house, when it's very cold, my breast becomes sore and feel tingly. Any ideas if this is normal, even if I've just fed, so not full? That sounds a bit like Raynaud, doesn't it? Like Raynaud's. Do you get Raynaud's in your fingers?
Do your nipples go a little bit white or purpley? You might need to wear an extra t-shirt. Do what your mum says, put another vest on.
I knew mum, when I used to work at the Abingdon Baby Cafe, we had a mum who had problems with Raynaud's, and she went down to Mason's in Abingdon, which is the sort of the fabric shop, and she bought fleece, and she made herself fleece breast pads, so they were lovely and warm. So because often that we do know this, we know quite a lot of people feel like this, that when it is cold, and often what mums will notice is that after the baby comes off, because obviously the breast and the nipple is wet, and when the baby comes off, they get that Raynaud's reaction, which is when it blanches, the blood supply is drained from that area, and people see it in their fingers and their toes and their breasts, and it's very uncomfortable. So it's not uncommon. We have heard of it before, Gillian. So,
it's not a terrible thing, but you just need to keep yourself warm. So either sit with a hot water bottle, so you're really warm, and if you're going out in the car or something, take a hot water bottle with you if you're cold in the car, and just pop it down your jumper, just a warm bottle, or you can get little heat pads or whatever, but actually tuck yourself in properly You know, wear lots of nice warm things, lots of layers, because that will make a difference. See if it helps anyway.
Amy's come back, and this is to do with us talking about, you know, being responsive and relationship building with the baby. She's written, always talking, singing, silly voices to my little boy.
Exactly.
Almost 3 months. He's such a happy little boy, always smiling, breastfeeding exclusively, loves his cuddles. Perfect. And that's exactly what we're meant to do. We are meant to give them loads of cuddles, keep them close, love them so much.
And it
so
starts
important.
inside your tummy.
It
You know,
does.
we all start chatting to our babies in your own tummies, and partners sing, and you stroke your tummy and you tell them stories, and you know, they get used to the noises and your voice, and then when they come out, that just continues. But also you get used to talking to them, and you know, you always know second time mums, and I worked in a community hospital, and we had a lovely ward, and we used to listen to the mums, and the first time mums would be sitting there in absolute silence, and the second time mums and subsequent mums would be chat to their babies, because they're just so used to talking to babies. But actually it's quite a strange thing to talk to a little person when you first get a baby. But actually don't be afraid to do that. Just yatter away to your baby the whole time, and they will listen to you and watch what you're doing, and they recognise your voice, and tell them stories, and you know, talk to them all the time. When you're breastfeeding them, when you're changing them, when you're you know, cuddling them, just tell them what you're doing and tell them what you can see, and all of those things. You know, it just reassures them, and reassure them that you know, what they're doing is going well, and give them positive feedback, just like you like positive feedback. Babies do too, and that's all good for them to hear all of those things, and to hear the reassurance of their parents talking to them like that from a young age.
Right. So Emma was very, very kind, because I meant to send a message saying, could we see her message? Because I think we couldn't. I've had to reload.
I've got it now.
I've reloaded. We've just done Emma,
Yeah.
but I've just reloaded, and we've jumped up to 18 now. So it is. They are coming through, but I don't know why they're just not loading. But anyway, Amina has said, can I ask, I'm due in a few weeks, but my breasts are peeling near the nipple and already sore. Is this normal? And is there anything I can do? As worried this may result in soreness and bleeding when feeding with my first, thanks. Or like with my first. So you had it before, you poor love. Is it eczema? I mean, that's one thing to consider. Do you get eczema? Is it an area that could this be eczema? You can use eczema medications. It'd be worth checking with your GP on your breasts. We would normally talk about treating your nipples like your lips. Keep them moist. So using something, you know, you can use any of the nipple creams you can buy online, or something like Vaseline, as long as it's a nice clean pot. Keeping it clean, but that just lubricating the breasts may really help to stop you getting any worse, and hopefully make it better before this baby arrives.
Be careful if you're allergic to wool, that you're using lanolin, that it's not making it worse, because some people are allergic to wool, and if that's the case, then you might well have a sensitivity to lanolin, and that might make your nipples sore.
So for instance, Lant Snow, which is one of the brands that many people buy, is made from lanolin. It's meant to be very purified, but it is. So you know, that might be well worth considering. I think that's a good point, Naomi. But I think, thinking about keeping them moist. If you do have a tendency towards eczema, maybe have a chat with your GP and see what you could be using, and see if we can get this resolved before your baby comes. And if
it's got to be nice for you.
Yeah. So, you know, if you are still struggling, seek further support. I think that would be really important, Amina, before your baby comes.
And if you're not sure about the creams that you've got, then you can always ring us. We've got a book that we can look at the products and things, and double check that they're appropriate for breastfeeding if you're getting other specialist creams.
Pascaline's come back with some more information from earlier. So she said, thanks for what we said. She attaches to my left breast, great, but we have trouble with the right. A nipple shield has helped. I'm not sore, thankfully, and she just struggles to latch on to my right breast. It's interesting how some babies do struggle with one breast more than the other.
Sometimes it's because you're not as dexterous on one side.
She's feeding every 2 to 3 hours, and she has been cluster feeding the last 2 nights. I'm pumping where I can in the day and night, but not quite at 8 times. If you've got all you need, you don't need to worry about that, though. You don't have to be 8 if you've got what you want. When it's time to feed, she's offered the breast first, both, then any express milk, and then formula. So I think it's just trying to fit in as many expressions as you can. We're aware that it's hard. This has been hard. Yeah, there you go. This has been hard, but it's working for us. The midwives have been great, and I've asked everyone about my latch, and the Horton maternity unit did loan me a pump and taught me the compression technique. Good on them. I was just concerned that I might not be producing the right volumes. Sometimes when I pump, I only get 10 mils of one breast. Possibly I'm not waiting enough for my breast to fill up.
Maybe wait about 30 minutes after a feed and see if that makes a difference. Are you doing hands-on pumping as well? That's the other issue. If there's a great video called Hands-on Pumping, Stanford University, How to Maximise Your Milk Supply, and that's just on Google, and it just shows you how to make the best of your pumping. So if you're single pumping, you put the pump on one side and look at the flow and do some compressions while you're pumping. Don't look at the clock, look at the flow. So when you start, you turn the cycle up fast and you turn the vacuum down low if you've got two different dials on your pump, whatever pump it is, so that you've got lots of fast flutter and you've got less vacuum. And then when you start to see drops of milk, you drop the cycle down so that it doesn't pump quite so frequently, and you turn the dial up to get a little bit more vacuum, but just till it's comfy. You don't have to have it on full. That doesn't help necessarily. So just put it on till it's comfy, and then look at the flow, do some compressions, and look what's coming out of your breast. And if this is single pumping, then look when it slows down, take it off and put it on the other side and repeat the same again. And then go back to it again when the slow's on that side, and go back to this side again, and when it slows, go back to that side, and do it maybe 4 times in the time you've got, depending on what you're getting out. But you know, you need to go backwards and forwards. If you're double pumping, you might find that you need to put little holes in an old bra or something, and then your hands free when you're doing that. And it's the same. You do the same cycle, you do all of that, you do your compressions, you look at the flow, and you turn the pump volume down, and leave it for about 30 seconds or so, and then turn it back up, so that you're mimicking a baby's suckle, and do that about 4 times. So you're just literally doing what a baby would do if it was breastfeeding. And then when you've finished, you can turn the funnel over and you can hand express into the funnel. So that will just tap into the areas of your breast that the pump hasn't managed to get, and you can get up to 50% more milk in an expression if you do that. You know, some mums are really good at it and some mums aren't quite so good at it. We could talk about hand expressing now, couldn't we?
Well, I'm just aware we've got quite a few questions.
Oh, okay.
Oh, maybe not so many. There's a few questions. Nope, not so many.
But we could, you know, I can just run through it again just to make sure. So you've done the stimulations and things when you've done your pumping. So you may want to just massage your breasts a little bit before you put the pump on, or smell your baby, or it might have been that you've just had a breastfeed so your breasts are primed. But you know, if you've had a breastfeed and you're doing the triple pumping stuff that is so demanding, just leave it about half an hour if you can, and that will just allow your breasts to start to make milk again, and they're constantly filling anyway. They're like kidneys, they keep drip drip drip, you know. So you will get, as soon as you stop on one breast, you'll start to fill up again and feed off the other one, and then when you go back to that, you'll get it. So to hand express, you want to go about 2 to 3 centimetres from the base of the nipple. Make a C with your fingers and thumb, and you'll feel the texture of the breast change slightly when you're doing this. That it'll be a bit like broccoli, you know, lumps of broccoli. It's kind of a bit lumpy, and then you might want to just push back a little bit and then squeeze down and hold about 4 seconds, and then release, and then squeeze back and release. So what you're trying to do is bring your fingers together, so you shouldn't be rubbing when you're doing this. There shouldn't be any rubbing, it should be just pushing backwards and squeezing down and holding. And then you'll see little drops coming, and if you've been pumping, you'll see little bits more coming. It won't be flowing out massively, but you will get little drips coming, and it'll drip down your fingers and into the funnel. It's quite messy. And then you can turn your hands around the breast like a dog face.
Sorry, I thought you'd finished, Naomi.
Go around, and then you would go to the other side and you'd do the same again. And if you're just hand expressing, you would repeat it on the breasts again, so that you've got the flow going, and then you go back and you get it. So that's just basically how you do hand expressing. It's very easy, but it's your emergency care if you've just had your baby and you're not actually managing to feed your baby a lot, and perhaps your nipples are a bit sore or you're not so good at attaching. That will enable you to protect your supply and make milk, and it gives you food to give to your baby while you're learning to breastfeed. So protect your supply in all of this, and that's the first thing, is hand expressing will do that.
Okay, hope that helps, Pasqualina, and good luck with it all. It's tough work what you're doing, but
well
worth
not
it.
getting on the other side as well, was it? That you're not attaching so well on the other side. I think, have you tried mimicking the side that you're good at?
Oh, yeah.
That sounds,
pretending you've got two of the same breasts for the baby.
So, when you've got your baby, if you're feeding well on your right breast, you want to just slip your baby around and imagine that you're feeding well on your right breast. And so it might be that sometimes the baby's tongue function isn't great on one side just from the birth, the way they've come out, whatever, and it takes a little while, and good feeding is good physio. So, over a period of time they become better at it. But if they're not given the opportunity to feed well all the time, they don't get that good physio. So the more they feed well, the more the tongue function improves and attachment improves. And also your breasts are different shapes and your nipples are different places and different sizes. That's all completely normal to have all of those things going on. But sometimes just moving, if you're like this, move your baby round to that side, and that might just, you're more dexterous because you're used to putting your baby on a breast this way. That might help you. Another way, if you're really struggling, is to do laid back feeding. So your baby is in the same place on both, and that sometimes helps as well. And go to, how many days is your baby? Is it early days? Are you still seeing the midwife? Get your midwife.
No, I think they're on midwives, if I remember rightly.
Or Oxfordshire Breastfeeding Support. They may be able to do a session with you just to see if they can help. If you're still struggling, give us a call as well. We can talk to you again and watch what you're doing. But that's, those are little tricks that you can use, and I'm probably certain I'm telling you how to suck eggs, but it's always worth a try again if you're struggling a little bit.
Good luck. Right, Steffi has written, I've been exclusively breastfeeding my little boy who's now 15 weeks. Well done. He's 8.5, a big boy, you're right. But he has got into the habit of grazing, which has now led to hourly night wakings to feed, seeks comfort to fall back to sleep. The health visitors advise stretching his feed to 3 hours apart. Is this something you would recommend? It's very difficult when the baby's decided that. That's the problem.
Are you doing things like compressions? Can you get more into
get a
him
bit
in a
more
short
in him.
space of time? Make him feed, keep him going, wake him up, poke him, get him back on, and maybe lie down when you're feeding him, so he sort of suckles with you, and give him some compression so that you're not disturbing him too much, and then move him over to sleep. But it is hard, and it's a busy time, isn't it? 15 weeks, did you say? Yeah, they're very nosy at that time, so they just sort of rubberneck on everything. They're really busy, and of course they would have you every hour if they could. Which baby wouldn't? Mummy is the centre of their universe, and if you let them do it, they will. But I think you can. Maybe, does he do it in the daytime as well?
So it seems to be the nights, but got into the habit of grazing, which has now led to hourly night wakings to feed, seek comfort, to fall back to sleep. So maybe try and fit more feeds in the day is the other way, because babies need a finite amount of milk in a 24-hour period, and if you've managed to get a bit more in him, he may not be looking for it. But it might be a lot more to do with just wanting you there rather than just food.
Is he teething?
Yeah. Is he warm enough is the other thing?
Yeah.
No. So, things that might rouse him. But unfortunately, that's what, as Naomi says, babies just love to check in with mum and want to know you're there.
It does go on a bit though, doesn't it, when you're tired? It's quite exhausting, and if you've got another baby and they do that all night, it's absolutely draining after a period of days. So I think just see if you can change the pattern somehow.
Yes, it's changing little routines, isn't it? Yeah, best of luck, Steffi.
Yeah.
Hopefully it'll be just one of those things.
Him for 3 hours is really difficult.
I think you'll end up with him crying.
Shredded.
Yeah,
I think you'll be crying as well.
Try and get more in him, I think, would be, when he does wake, get more in him, so he's more likely to then go that little bit longer. So
and try compressions as well. He might respond to that and get a bit more milk in when you're feeding him for that short period of time.
Emma's come back. You asked about what temperature the formula was when she was being offered it, and it's at room temperature, so that's fine.
A little bit,
just try a little bit warmer. Yeah.
So it's breast milk temperature.
Yes, but say
the inside of your wrist. If you can't feel it, it's exactly right. So just body temperature, and sometimes that means that they recognise it rather than it being a different temperature, because breast milk is body temperature, obviously. Yeah. So make it the same temperature as your breast milk, and that might. From your breasts, and that might help.
Sounds like a good idea. Steffi's come back again. Hourly night wakings having been happening for over 2 weeks now. Oh gosh, you must be shattered. That is hard work.
Feel your pain.
Yeah. I think maybe try some of the things we've suggested, see if you can get a little bit more in him.
I think the thing when you've got babies that do that is you just do it and then think, oh, they'll go to sleep and it'll be fine, and then they wake up an hour later and you think, oh, I'll just do it again, and you go to sleep. And you just end up doing it, and it happens night after night, because you think, well, tonight he might sleep a bit longer, and it doesn't happen, does it? So I think that it's easy for everyone in the house if you just feed him and then put up with him waking up after an hour, and then that breaks the cycle of what's happening, doesn't it? There isn't an easy answer. I think there's lots of parents that walk about the streets with babies at that time of night with prams, and try and get them to go to sleep with a walk, but it's like, setting yourself up for doing that to get them to go to sleep is really difficult. It's very frustrating, and I think there isn't a right answer for it, really. It's just, you've got to try different things to see what works for you.
Emma's come back and thanked us for the comments, for what we've said, and Gillian's come back and said, perfect, thank you ladies, I'll layer up and get little heat pads, good idea.
Those ones that you use on the spectator on the rugby pitch and the football pitch, the ones that you crack, that you can just break and they get warm. Yeah. Sometimes they're really good. You can just pop them inside your bra. Hand warmers.
Charlotte's come, and I'm surprised. I was wondering where Charlotte was. I thought she must be doing her Christmas shopping. Charlotte's on here. She's one of our top fans. Hi ladies, hope you're both well and keep you safe. Alicia says happy Christmas to both of you, and she's 5 teeth now and another on the way. Oh, well done you. My word, that's impressive. Right, I'm going to have to refresh because
I think the other thing with all of these questions is that you haven't actually got access to anybody else to talk to.
I know.
You haven't got any other mums that you can talk to that say, oh yeah, my baby does that and this is what I tried and it helped for me. Peer group support is massive when you're with new babies, and all of you have missed out on that. It's 9 months of no groups, no meeting up, no coffee mornings, all of that has just disappeared, and that's so important in your development as a mother, and you've missed out on it. All you've got is your family, and it might be that your mum or your grandmother breastfed a long time ago, and that everything's changed a bit.
If they breastfed,
and that's changed a bit. So there's a lot of pressure that you've got to take their advice, which might not be the most up-to-date advice. It might be what they remember doing, and things have changed. So it's a very frustrating time for everybody, and we do feel very sorry for you because you aren't able to do that. But if you have had any groups at all, just keep talking. WhatsApp is something we didn't have as mothers when we were breastfeeding at 2 o'clock in the morning, and that is a positive thing of the internet, is that you do have 24-hour contact with people, but it's not quite the same as having a good old natter
face to face,
and having a cup of tea and a piece of cake, and just saying, does your baby do this, does your baby do that, and watching what the interaction is with your friends, and seeing how they manage their babies, and then you think, well, that's a good idea, I'll try that, but actually you're not seeing that, and that's really difficult.
Pasqualina came back and she said, thank you very much, lots to try. She's a week old. That means you're still under the midwives, Pasqualina. Get help. Get them to give you a hand, and get in, if they are unable to provide the care you need or provide, meet your needs, then get in touch with us and we can send you information. Jessica's come on and said, my little one will be 4 weeks on Saturday. She was born £8.3 and dropped by 2 weeks ago. Back up to 8.10. I weighed her on Tuesday. She's £10.
Wow. You've got Jersey milk in there, haven't you?
I do have to wake her in the night if she goes 5 hours. I do have to wake her in the night if she goes 5 hours. Or can I just do on demand now she's been having a stretch of 4 to 5 hours, then every 2 we're feeding lots in the day? I think so. For some comfort, what do you recommend for the comfort side of things? Well, I think first and foremost, I'd say, well, with that weight gain, you can afford to leave her, to let her tell you when she's hungry.
Probably wake up after 5 hours and 1 minute.
Yeah, just leave her, let her go, let her tell you when she's hungry. But what we anticipate, though, you're talking about the comfort feed and everything, and feeding. If we have periods of time, and I mentioned earlier, a finite amount of milk is needed in a 24-hour period. If a baby has a long gap, they're going to have other periods of the day where there are little short gaps, and that's normal.
I'll chase it.
Yeah. So if you think about 8 feeds in 24 hours, if they have a long gap, they're going to have to make up for it at some point in the day. So you will have periods of the day where the baby's feeding a lot, and other periods of the day where your baby has bigger gaps. So the benefit of having a 5-hour stretch at night, if that's what she's doing, is that you may have to feed more frequently in the day. So that's the contrary to it, really.
and she may well cluster feed after she's had that sleep, even if it's the middle of the night. So if she goes from 8 until 1 or 2 o'clock, then she may have 2 or 3 feeds quite close together to catch up. So, and some babies do go through the night very quickly and some don't go at all, and both of those are normal. So, and the thing is, you won't get her to feed if she's sleepy. Nothing will get them to feed. If they're not interested, they'll get cross with you when they're not interested in feeding at night. But all babies should receive milk for at least 6 months. If they're waking up at night, they should still get milk. So you can't substitute it for anything else. They should get milk even if they're formula fed or breastfed. If they wake up before 6 months at night, in the night, they still need to receive milk. So you must remember that they need food.
You say about the comfort side of things, but actually the breast is there, and that is part of it. The breast is part of the comfort side of things. So, the breast came well before a dummy ever was designed. So being that mother, it is part of our role is to provide the comfort, and the breast is the best form of comfort for a baby, and you're meeting your baby's needs for closeness and comfort. There was I've said it many times before, and I'm sure I've said it on this before. There's a lovely saying on the BFI, the UNICEF Baby Friendly Initiative website, and it says, I feed my baby for comfort, the nutrition sorts itself out. So if you just meet your baby's needs, the food side of it sorts itself out. So obviously you can try things like cuddling and using a sling. That might meet her needs as well, and might stretch it out when you are having those periods of time. But a lot of what we do with feeding is to do with comfort as well, and actually you're doing a brilliant job. So it's remembering that, and it's normal, very normal baby behaviour. Steffi's come back and said, started off the 12-week immunisations when he started fussing feeding, and also grazing in the day too. He was feeding and sleeping well before that. That often's the case, isn't it, though? The immunisations can knock them for 6 for a little bit, can't they, Naomi?
Just sit tight and go through it. And, just in the daytime, see if you can spread it out a little bit. Maybe go for a walk, give him a good feed, go for a walk, put him in a pram, tuck him up really well. And the movement will keep him settled. And it might be that you can eke his feeds out a little bit longer in the day just by doing something else. Put him in a sling, and that just extends his sleep time. So then what he does is he empties his tummy properly, and then feels hungry and wakes up and has a really good feed, and it breaks the cycle. They're very happy just to be topped up, and as long as you're doing it, they will ask for it. As long as you're doing it, they'll ask for it. So if you're doing that, they'll just think, oh, this is what's happening now. I'll keep doing that. I like mummy. I'm going to do this again. But if you distract and go and do some shopping or go for a walk around the block and just eke it out a little bit each feed, it might be that you can get 10-15 minutes extra in a sling, and he sleeps a bit longer. Over a period of a day, you can delay the feeding a little bit so that he waits a bit longer each time, and then he learns to empty his tummy and fill it again rather than just topping it up all the time.
Right, Jessica's come back. She said she does feed for about 40 minutes on each, and that's quite normal. Anywhere between 5 and 40 minutes is a normal feed. So that would be a pretty normal time. So, right, I'm going to refresh again because it was my refresh.
We're almost at time as well.
We are.
If
there's any questions come through, I feel we ought to do them. Yeah, we have a couple more, I think. Charlotte's come back again. She's saying her confidence got better when I became a mum for the first time. And do you know anywhere to take my Alicia swimming? I'm afraid I don't know what's happening with swimming pools, actually, Charlotte. Might be worth phoning your local leisure centres and finding out what's happening and what you can do. But it'd be worth a try.
Your health visitor might know.
Yes, that's true. Mariam has come on and said, hi ladies, I did breastfeed my son until 3 years old, and now I'm pregnant. I stopped breastfeeding a while ago, but I can feel my breast is hard and painful. I think I still have milk, but it's dry. What do I do to get rid of it? I think leave it, actually, don't you? I think, when you're pregnant, your breasts do become firmer again. And
very sensitive.
Yeah, really sensitive.
How pregnant are you? Is it early pregnancy? It can be very sensitive in the early parts of the first trimester particularly, and then it gets a bit less towards the 20 weeks. But and also you start to produce colostrum from about 16 weeks. So some mums will find that they've got colostrum in their breast from about 16 weeks, and it leaks a little bit, but some mums don't find there is any at all. You can get infections in your breast when you're pregnant and when you're not pregnant. So if you're not sure, go and see your GP, get it checked. But I wouldn't do anything, and you don't want to be hand expressing at this stage if you're pregnant.
No. I mean, you could try warm compresses if that helps, make you feel warm. But exactly, ibuprofen if you can take it. But we wouldn't be suggesting.
Same pregnancy.
Oh yes, sorry, that's true.
So it's paracetamol.
Paracetamol
really.
only.
Yeah.
Sorry.
Yeah.
I forgot. We're always telling mums for afterwards, so I forgot that.
Yeah.
What was I saying? So it's just keep the breast as comfortable, but we wouldn't be recommending doing any expressing or anything at this stage. Just leave them; they will sort themselves out.
And if you're seeing your midwife, get her to check when you see your midwife if you've got an appointment fairly soon, or if you're worried, make an appointment with the GP and just get it checked.
Sophie's come back and thanked us. Said we're always helpful and supportive. We try to be. We do, don't we? I think we're almost there. So let me just do one more.
Week. There's been lots of babies in Oxford on the wards. I've
met lots of them today. We've been around doing teaching today, and that packs that we've just been showing you. We've been going around and meeting lots of mums, just giving them as much information as possible. Mariam's just come back and said that she's 11 weeks and this pain started even before pregnancy. Right, well then I think you should see the GP if it started before pregnancy. Go and see. We have here in Oxfordshire we have the Oxfordshire Breast Imaging Centre, and they are very good. They're really good specialists in breasts. Any of our mothers that we meet who have really acute mastitis or abscesses will end up under them. So go and see GP and tell them this has been going on and it's pre-pregnancy as well. That's quite important.
They may want to scan.
Yeah, so I think that would be well worth it, Mariam. Go and have a chat with somebody about it.
Yeah, get it sorted.
I think we're going to sign off now, ladies. I'm just doing one more refresh and make sure.
So we're looking forward to having a telephone that works next week, because we really have seen that normally we have like snow going across the screen with lots of likes and ticks and all sorts of things and questions coming up, and there's absolutely nothing happening at all. It's
no
quite
activity.
Weird. So hopefully we'll be back to normal next week.
And also my laptop normally does loads of the questions as they come.
Been a bit weird today.
So sorry about that.
Not only did we start sideways, which is very weird.
That will tickle my mum pink, because one time we did do it sideways, if you remember, when we were upside down, and I told my mother, and every time I tell my mother I've done this, she says to me, "Were you upside down today?"
No, sideways, Mum.
Right, Charlotte's just come back saying thank you, ladies. Hope you have a lovely Christmas and New Year, and it'll be good to see soon. Be normal soon, she said. She's saying she'd go through pregnancy again because she's fallen in love with her baby. Her lovely daughter, Alicia. Isn't that lovely?
That's all part of the relationship building, you see.
Right.
It's all inside you.
I'm really hoping I haven't missed anybody's questions. I'm just going to do one final check. Mariam's come back and said thank you. And I think we'll say thank you to you for all your questions again.
Yeah, it's lovely, as always.
Right. Thank you very much. And
happy Christmas shopping.
Yes, and we'll see you next week. Okay.
Have a good week.
Yeah, bye.
Bye-bye.